Okay. All right, guys. Core time. So, hey, if you have lower back issues, hip issues, thoracic spine issues, postural issues, we've done all kinds of stuff here. This whole thing of like trying to get your mobility working, stability is the key for this part. But guess what? If your mobility sucks in your hips and thoracic spine, your core isn't going to engage like it's supposed to. So that's why you take those other videos, work on thoracic spine and hip mobility so your core can actually do what it's supposed to do. So this is what this video is about. Stay tuned. Okay, so the first one we work on is a dead bug. You might have already heard this if you've done some PT or just seen on YouTube in general. The reason why we start here is because the spine is supported. Okay, we're gonna work here and then transition to harder stuff. So the first progression is we're just going to make sure you're using your arms. We're gonna start easy. But the thing is, can you start in a good neutral position? So you arch the back, flatten the back. Do this a few times, get a good stable foundation, sniff in with your breath, get tight behind the shield, brace behind the shield, and you're gonna do one arm at a time. So he's keeping this stable. So yeah, we're moving, that's a fault, that's a postural issue. If that happens, you actually might have a thoracic spine mobility issue or maybe a lat tightness, like something is stopping you from going through this motion, and so your body compensates and then you arch the back. Don't do that. That's all. This is a good exercise, but it's also an assessment too. Okay, so you're doing 5 each arm, so 10 reps. The next progression, so that's step 1. Step 2 is we're going to do the other end of the body. Just going to lift the foot off the ground. This should stay stable. What will happen is a lot of times like your pelvis will twist, it'll tilt, it'll rock, it'll extend. Here's another assessment too. This should stay nice and stable, or you need to go back and foam roll, hip stretch, do something typically with the hip mobility. Same principle applies. 5 each leg, doing 10 reps. So we did 1, then we did 2, now we're doing 3. Now we're gonna make it a little bit harder with the legs. He's gonna go down, tap the heel, come back up. So this is where sometimes, especially whenever you get going, that back will come off the ground. Don't let it. Remember, sniff in some air, keep this nice and tight. 5 each leg, 10 each side. Now, you've done all the work. Don't skip the work, even if you're really good at this. 1, 2, 3. Now here's your bread and butter. Here's what you're really trying to get towards. You're going to do opposite arm, opposite leg. Now you see how Doc actually straightened the leg on this one. Should be a lot harder than just the heel tap, okay? Now, this will be the point of focus, okay? Don't lose this position, okay? Now, also, if you have a neck dysfunction, which we have a lot of that too, keep that chin tucked. Think about the spine getting long, because what your tendency is to want to tilt that chin up and kind of arch the back. Then you're kind of defeating the purpose. It's hard for you to keep the core engaged when you're trying to actually extend the spine, okay? So here, 1, 2, 3, get you ready for this prime movement, all right? And if whenever you're bringing one leg down, the other leg there, if you go too far, you can feel it start to break. Just don't go down as far. Do like a half movement and then stop and then come back up. Okay? Have fun with this one. This is a great, easy one to start with. What's the next progression? We'll see. Okie doke. Now we're in a suspended spine position. So legs on the ground, hands are on the ground, spine is suspended. So what we want to try to do is keep this engaged. So what do we always do? Arch the back, flatten the back, try to get that good neutral position, almost like you're doing like your cat-cow, but do it a few times, get that good neutral position, and keep it there. He's going to engage his shoulders, so he's going to kind of push the shoulder blades away just a little bit. Nice and long, chin down, head down, perfect. Now, just like we did in the dead bug, which this is the progression of a bird dog, he's going to do his arms first. It is literally the same move as the dead bug, but you're going against gravity here, where on the other one, you're letting gravity kind of pull the arms down, okay? So there again, lats are tight, cause a problem. Can't maintain thoracic spine position, that's a problem. That's why you do the other stuff first. There again, 5 each time, 10 reps overall. Here, we're doing the same thing we did on the second one. Progression number 2. Now, instead of just doing the heel tap we did on the dead bug, we're doing a toe kind of slide. All he's doing is making sure this pelvis does not move. What'll happen sometimes is it'll drop that pelvis down, because once you're sliding away one of the table legs, this hip isn't stable and it causes that hip to drop or shift or compensate. You are nice and stiff and still right here, okay? 5 each leg, 10 reps. Step 3, gonna make it a little harder, just like we did in the dead bug. Now you're just raising the leg up. Now I like to make sure, hold at the top position now. He's straight. He's not extending because you're gonna break here in the lumbar spine. It looks pretty, it looks super cool, you got good range of motion. I don't care about all that. This should not move, okay? He shouldn't have a sway back in here when he does his movement. You should theoretically have a nice little drink and it shouldn't move, okay? Now, you did 5 each leg, 10 reps, 1, 2, 3. Now here's the meat and potatoes. The bird dog, okay? He's gonna do opposite arm, opposite leg. There again, yes, he's doing a lot of movements of his arm and leg. This should not move, okay? Chin down, head long, everything is tight. He's theoretically thinking of his head going to that wall, his tailbone going to the other wall. His spine is nice, long, but stable. Then can you breathe? Here's the bird dog. All right, now we're getting back to a traditional ones. We're going to pretty much think of the core as a can. We're gonna work on the glute bridge part, then we're gonna work on a side plank, side plank, you're done, okay? First, we like to give you a little bit extra resistance. Put a band. Now, he did a really good job of making this bad boy flat. I would recommend keeping it flat. If it starts to kind of roll up like this and you don't have any shorts on, it's not gonna feel too good. Take that warning. So right here, pick the butt up off the ground. Good, nice neutral position. He's not arching his back and doing a lot of lumbar spine extension. He's only coming from the hips. You should feel it in the glutes, your butt. Okay, if you want to make it more of a glute contraction, bring your toes up off the ground, draw the heels into the ground. Sometimes people have glute amnesia. They don't really know how to turn these hips on. This is kind of a good, easy way to do that. This is step 1. Now, if you can do this, you can just raise a leg. Good, you can take a step. This is kind of like their dead bug progression, but you're using a band for a little bit of extra resistance, okay? Now, some people want to actually kind of straighten the leg too. I don't care if you straighten the leg, as long as you don't go like way up here, you're keeping everything nice and in line, okay? So you can do a march, kind of like he's doing here, where he's working on not tilting and twisting in the pelvis, or you can just sit there and hold that bad boy for a good 10, 15, 20 seconds and work on an isometric exercise. Sometimes, honestly, when you're in a lot of pain, isometric exercises are a great way to kind of drive through that pain and still work on strength, okay? So this is the glute bridge part of it. Now you're just gonna roll that way and we're gonna tackle the side plank. For this one, I like to make sure the ankles, hips, and shoulder are kind of all in a nice line for this exercise. Now, also keep the shoulder packed. A lot of people have some shoulder pains, so if he's just kind of lazily laying on his side, he's gonna jam up his shoulder. If you have impingement problems, not gonna be good. Engage this lat, keep everything nice and stiff. You can even do just like you did, bug. Nice, good brace. Then he's going to pick his hip up off the ground, and he did like a hip hinge. So he go ahead and set back, he hinged back, he's going to hinge forward. Now his knee, hip, shoulder are nice and line, okay? So he's working this side of the core. He's going to add a little bit of extra external rotation at the hip. So yes, he's moving this one, but you'll be surprised. This one is doing a lot of the work too because he's having to keep this bad boy up. We're gonna do 10 reps each side. You're pivoting off of this ankle. Now, if you want to add a sit here, your lady's like, oh man, this is super simple. Let's make it a little harder. You can raise the leg up like this, or you can straighten this leg, bring it back just a hair, and just do little baby pulses just like this. See if you can get a little bit of abduction right here at this hip. That's a butt burner if that's what you want. All right, we're gonna go to the plank. Now we're gonna do this one just a little bit different. Everyone's used to doing it on your toes. We're actually gonna make you do it on your knees. So the plank is an anti-extension move. So go ahead and let your back sag. That's a lumbar spine extension. We don't want this. We're trying to almost kind of flex this position and maintain it here, okay? I always tell people in this position here, you're on your elbows and on your knees. You know that machine you're at the gym, you kind of grab the handles and you're sitting there doing your crunches? This is what you're theoretically holding that isometric position, okay? So I want him to think of, I want my knees to drive to my elbows. Good, can he keep it there? This is honestly hard enough by itself. Of course, we always like to make it harder. We got a beautiful band around the knees, let's make it harder. Just lift that leg up off the ground. Don't move here. That is your goal, okay? He's doing like the marching type step. But there again, he can sit there and hold it for 10, 15 seconds if he wanted for that isometric type contraction. You'll start to shake a little bit, which is a fantastic thing, okay? So there you can rest. There you had your bridge, then you had your side plank. He rolled over to the regular plank. Now he would do the other side plank. This is our fun core series. Enjoy it.